Welcome to Addictive Entertainment, where we deliver the best entertainment daily. r/coronavirus. People with blood type A may be more vulnerable to coronavirus. Research in Wuhan and Shenzhen indicates patients with the blood group had higher rate of infection and tended to get more severe symptoms. Those with type O had a significantly lower risk for the infectious disease. Boomers are ignoring coronavirus risks, and their millennial children are scared. My mom keeps telling me how she's not that old and how this isn't the end of the world, and she's over 60. I think the biggest issue is that boomers don't really believe they're elderly, so they don't think this will affect them. Yes, the oldest boomers are about 74. So they're under 80, and thus see themselves as not that old. They are right, in that they're not the generation with the biggest risk. It's their older siblings. But boomers are still old and at risk. I think it's more than you just tend to forget how old you are when you are that old. When you're 60, it seemed like just a little while ago you were turning 50. I called my mom to ask if my grandpa was staying inside after CDC said anyone over 60 shouldn't go out in public. She called him. Her message, "Your grandson is worried about you," in a laughing tone. He went to a fucking casino that day. Fuck me for giving shit. Haha. If you needed some good news, 50,000 people have now recovered from the virus. It's easy to forget that you're far more likely to recover from the virus than die from it. A 98-year-old patient recovered from coronavirus in China. Fuck yeah. It's good to see any sort of positive news, RN. Dude, really. I've never felt so anxious at home and for my loved ones. I survived nearly 100 years, I'm not letting no fucking virus end that for me. It'll be a cold day in hell before a light beer kills me. Take this seriously. Coronavirus is about to change your life for a while. Does anyone else feel like they're taking crazy pills, talking about this with others? I'm trying to be even mildly prepared for this to pop off, but people treat me like a fucking kook. Oh, there goes Ultanen again, ranting about how Italy saw a 10-fold increase in infections in a week. What a nutty guy. I feel like I'm going insane. My aunts are posting shit about how more people die from the flu. Cool, but the whole world doesn't get the flu in one fucking go in a few months. We had the same reactions here in Italy 10 days ago. In 10 days, people everywhere in the world will understand how serious this disease is. I'm a critical care doctor working in a UK HCID, High Consequence Infectious Diseases, unit. Things have accelerated significantly in the past week. Ask me anything. Besides taking the preventive steps outlined by health organizations, how can regular people help? Also, I'm still not sure about effectiveness of masks. Some experts say masks will make things worse, and others say even DIY masks are better than nothing. Where do you stand on this? Lastly, hope you'll stay safe and UK will get it under control quickly. Thank you. Regular people can help by being sensible about not gathering in large numbers unless necessary, staying at home if feeling unwell, and taking the usual hygiene precautions. Think of it in similar terms to vaccination. Transmission is more effectively reduced if everyone takes steps to stop themselves getting infected or transmitting. If you are in the UK, I would also add, please contact your MP and ask them why the government has not yet introduced quarantine measures. The masks question. There is no doubt that as a population measure, masks help when they are widely used, e.g. in Asia. But it's possible that everyone will need to be wearing them, and using them properly, for it to work. The mechanism would be prevention of gross droplet spread during coughs and sneezes, and preventing surface contamination. I wonder if it also helps by preventing people from touching their faces. As an individual, wearing a mask might not help as much, but we don't have the evidence to know either way. In hospitals, our staff undergo something called fit testing to teach how to put them on and to test effectiveness. If used improperly, or if they do not fit perfectly, FFP masks are not good for their primary purpose. In hospitals, we use them because we are at risk of direct droplet exposure when close to a coughing patient. Without masks? The most effective things you can do: wash or sanitize your hands, as much as possible. Don't touch your face. Also, cough/sneeze into your elbow, not your hand. Also, please don't stockpile. Many hospitals are reporting shortages of FFP3 masks with difficulty in NHS supply chains. Are we likely to see an Italy-style outbreak in UK, or is it relatively confined? The consensus amongst my colleagues in general is yes, it will get much worse, and it is likely to reach Italy levels. We are preparing for such, but there is only so much we can do from within a hospital. As a health system, the UK runs at or over capacity. It is worth remembering that the background population of critically ill does not decrease in an outbreak. There was a feeling a week or two ago, when we started seeing community clusters, that population measures needed to be taken. The feedback we have gotten from colleagues in public health or those involved in government advisory positions has been that there is a question of balancing short-term economic burden against a predicted mortality. I personally think this government response has been short-sighted. We have very good case studies, in Italy, showing what is likely to happen if delaying measures are not taken early, vis-a-vis South Korea showing what can happen when strict measures are taken in a timely fashion. The key is to prevent healthcare demand from being overwhelmed. This is the point where mortality rises. Again, my personal opinion is there is a problem in the UK amongst decision makers with denial and concern about the political optics of early population measures that affect the economy. The problem is, with outbreaks like this, you won't see that you are about to be overwhelmed until the day before, and you needed to have taken action at least 2 weeks before that. Lessons from China, from South Korea, and current lessons from Italy and Iran are not being listened to. My husband and I are young, but he is immunosuppressed, so we stopped commuting/socializing 2 weeks ago to minimize opportunities for transmission. Given how understrained the NHS already is, what do you think the best steps are for vulnerable people if they feel unwell? Bearing in mind that at the best of times medical teams are understaffed and human error can occur, there is no cure that the hospital can provide, and there is a notable risk of other infections. Do you envision a point where it is safer to try and ride it out at home if a vulnerable person does get sick? This might be overly pessimistic, but I'm seriously concerned that at some point hospital treatment will be dangerous. Without wanting to give specific medical advice, if you or your husband become sick with simple cold or flu-like symptoms, then it is perfectly reasonable to ride it out at home, as long as your husband's team/consultant is happy. Your husband should take advice from his usual team about what immunosuppressants, if any, to pause, but he will know this. If you feel more unwell or short of breath, then you would of course need to come into hospital because you may need to be supported with oxygen. There is thankfully a long way to go before hospitals become actively dangerous, and I hope we will not get to the point where we are unable to deliver safe care, even if we have to prioritize who we deliver this care to. You and your husband are both young, so please don't worry, but take care. Thanks for taking questions. Do you believe that countries in the EU should implement quarantines like Italy at this stage, or wait until the time is right, i.e. when community spread has taken hold? Community spread most likely existed in the UK a week ago, and now it is likely to be widespread. Any quarantine measures now would be to delay spread and not to contain. This does not mean that they are not useful. We need measures to slow spread and prevent healthcare systems from being overwhelmed. So yes, we definitely should be instituting some form of quarantine, or closing schools, etc. The numbers in Germany are interesting, exceedingly low mortality compared to other countries. The likely explanation for this is Germany started testing comprehensively at a very early stage of population infection, and that a large pool of positive cases exists in communities prior to the first clusters of critically ill and deaths appearing. This would suggest that we are quite massively underdiagnosing in other countries. Unless it is something in their diet.